Welcome to myeyacademy.com. I'm Professor Mahfouz Hussain from Pakistan. Myeyacademy.com is a platform for ophthalmic teaching. In this video, VMCQ 2.1 will talk about the basic ophthalmic sciences MCQs. Before starting with the MCQs, let's study this slide. These two are photos of the eye. Look at this yellow arrow and the part in front of the yellow arrow. This area is called anterior segment, while the part behind it, which is vitreous and retina and optic disc, it is all called posterior segment. Then anterior segment is divided into two parts by the iris. So the part in front of the iris and behind the cornea is called anterior chamber, while the part behind the iris is called posterior chamber. In addition to that, look at this photograph. It's not all retina. This is retina plus optic nerve head plus blood vessels. So all this is collectively known as fundus. With this background knowledge, let's start the MCQs. First MCQ. Space behind the cornea and in front of the iris is called posterior chamber. No, this is the space behind the iris. Anterior chamber, that is probable answer. Anterior segment, that is collectively posterior and anterior chamber is called anterior segment. Posterior segment is vitreous and retina, and aqueous is a part of posterior segment. So the answer would be anterior chamber. And anterior chamber is the correct answer. Fundus is the term used for retina. Retina is part of fundus. Disc and blood vessels, yes, but they are part of fundus. Disc, retina and arteries, they are part of fundus. Disc, retina and veins, they are all part of fundus. Disc, retina, arteries and veins are collectively called as fundus. So that would be the right answer. And that is the right answer. Look at this slide for the next couple of MCQs. Ophthalmoscope and retinoscope. Remember the mnemonic R for retinoscope, R for refraction. So retinoscope is used for refraction, and ophthalmoscope, remember this mnemonic. Ophthalmoscope, the red one is the fundus, so ophthalmoscope is used to see the fundus. This is called ophthalmoscopy. Ophthalmoscope is used to see the fundus, and this one is called retinoscopy. Retinoscope is used for the refraction. So with this knowledge, we'll do the next MCQs. Ophthalmoscope is used for, remember, O for ophthalmoscope and the red retina, refraction, checking pupillary reaction. You can use it to check pupillary reaction, but that's not the main purpose. Measuring intraocular pressure, no. Examination of the optic disc only, no. Examination of the posterior segment, yes. That might be the answer because we use the ophthalmoscope to see the optic disc, retina, macula and blood vessels. So that would be the right answer. Examination of the posterior segment is the right answer. Next MCQ, retinoscope is used for, remember, R for retinoscope, R for refraction. So the options are refraction, checking pupillary reaction, measuring intraocular pressure, examination of the posterior segment, and number 5, examination of the optic disc. So the answer would be refraction. And refraction is the right answer. Next MCQ, the red reflex of the eye is because of blood vessels in the conjunctiva, blood in the choroid, blood in the retina, reflection of light from the retina, or refraction of light from the cornea. The answer lies in the video VHP 2.3. That this is the red eye and this is the red reflex, and the red reflex is because of the reflection from the retina. So the right answer would be reflection of light from the retina is the correct answer. Next MCQ. Papilledema is optic swelling because of arthritic ischemic neuritis, optic neuritis, increased intracranial pressure, central retinal vein occlusion, disc druseness. All these 5 conditions, they do cause disc swelling. So for the answer, you have to study section VHP Video Handbook 2.3. And if you look at the slide, disc swelling because of increased intracranial pressure is called papilledema. So the correct answer will be increased intracranial pressure. Next MCQ is aqueous humor is drained by trabecular meshwork, suprachoroidal space, ciliary body, trabecular meshwork, and suprachoroidal space passing through the vitreous. Trabecular meshwork causes 80% of the drainage, suprachoroidal space causes 20% of the drainage, ciliary body produces aqueous humor, so that's not an option. Trabecular meshwork and suprachoroidal space cause almost 100% of the drainage, while passing through the vitreous is not a normal drainage site. So the correct answer would be number 4. Let's see. Trabecular meshwork and suprachoroidal space is the correct answer. Next MCQ. Aqueous humor is mostly drained by. So let's see. Trabecular meshwork, suprachoroidal space, ciliary body, evaporation through the cornea, or passing through the vitreous. Mostly means where the maximum drainage is being happening. So 80% of the drainage is through trabecular meshwork and 20% through suprachoroidal space. So the correct answer would be trabecular meshwork. Let's see. Trabecular meshwork is the correct answer. Next MCQ. Aqueous humor is produced by. Look at the 5 options. That's a drainage site, that's a drainage site, that's drainage, that's not normal site. So the ciliary body is the one that produces the aqueous humor, so that would be the correct answer. And ciliary body is the correct answer. Color vision is tested by Snellen chart, Ishihara chart, E chart, Logmar chart, or Len.C chart. Now remember, Snellen chart is used for checking visual acuity. Ishihara chart are color plates, which is used to check the color vision. E chart is a type of chart to check the visual acuity in the people who cannot read the letters. Logmar is a more detailed chart for checking visual acuity. And Len.C chart is also for checking visual acuity. So the correct answer would be Ishihara chart, which is used for the color vision. Ishihara chart is the answer. Thank you very much for being with me, and please do give your feedback. Thank you.